Okay, let's start the next module on skin and skin disorders. So we'll start off talking about um, the anatomy of skin and the structures of the skin, and then we'll move on and talk about different disorders of skin tissue. Okay? All right, so let's just start with the functions of the skin. So the skin is our largest organ. Okay. When we're talking about internal organs, that would be the liver. But as a whole, the skin is our largest organ. So number one, it provides significant protection from injuries, sunlight, so UV radiation, and of course microorganisms um, that are often on the skin. Okay. In actual fact, our skin is colonized with bacteria, with some fungal microorganisms. So the skin blocks these microorganisms from getting into the system. Okay. Number two, it also prevents fluid loss. Okay, so we need skin to maintain our internal fluid balance. And without skin, as we'll see with, for example, burns, there's tremendous amounts of fluid loss. Okay, so very important there. Regulation of body temperature. Well, blood vessels that go to the skin can vasodilate to release temperature or to release heat, or they can vasoconstrict to preserve heat in the body. So regulation of body temperature is another important function. Receiving sensory input, well, our nerves, as I'm sure most of you have experienced at some point in your life, our skin has a lot of nerves, right? In particular, our hands, our feet, around our lips, there's a lot of sensory nerves. Okay, so it's giving us a lot of information about the environment. And lastly, synthesis of vitamin D. So in the setting of sunlight, and typically we only need about 20 to 30 minutes of sunlight per day to produce enough vitamin D in our skin. So the vitamin D that we produce in our skin is inactive vitamin D. It's called cholecalciferol. This inactive vitamin D needs to go through a process of activation. And the first place that it gets converted is in the liver. But the real activation to active vitamin D is in the kidney to calcitriol. Okay? And calcitriol is the active form of vitamin D. Okay, so you can imagine if you have chronic renal failure, you'll be unable to convert inactive vitamin D to active vitamin D called calcitriol, and that will cause issues with absorption of calcium and regulation of calcium in the bloodstream. Okay, so remember, renal failure does a lot of causes a lot of issues in the body, and one of them is the inability to convert inactive vitamin D to active vitamin D. Okay, so let's talk about some structures that are associated in the skin. So we have sweat glands, and when we're talking about sweat glands, there's eccrine sweat glands, which are located everywhere in our skin, and they directly go to the skin surface. Okay, so and they regulate heat. Okay, so these eccrine sweat glands that we'll see in an image coming up, they go directly to the skin surface, and they can release heat in the form of of water, right? So when you sweat, you're actually releasing heat with the sweat. Okay. Apocrine sweat glands, they're associated with a hair follicle, and typically these are in the groin, the axilla, so the armpit, and they produce a bit of an oily substance. Okay, so that's the difference between the two sweat glands. Eccrine goes right to the surface. Apocrine are associated with hair, typically in the groin and the axilla. Okay, and some people can have a lot of problems with these apocrine sweat glands. They can get infected in the armpits or the groin, and sometimes people have to go for surgery to have these sweat glands removed. Okay, and remember, they're associated with hair. The next one is sebaceous glands. So they're they're associated with hair as well, and they're located throughout the body. Typically not on the palms or soles. We don't usually have hair on our palms or soles, and they produce an oily substance called sebum, which lubricates and can also release a bit of body temperature as well if needed. But they're mainly involved in lubrication. Okay, and they're activated during puberty because there's hormonal changes, and we'll talk about these later in the setting of acne. Okay. The next one, hair follicles. We'll come to an image of a hair follicle and we'll talk about it a bit more. And nails as well, we'll just review with an image in front of us. Okay, so here's an image of different structures within the skin. So it's always easier with an image. So as I mentioned, the eccrine sweat glands, they're a coiled structure and they go directly to the skin surface all over the body. Okay. The apocrine sweat glands, the ones I mentioned that are typically in the axilla, in the groin, they they secrete into the hair follicle. Okay, and they can be involved in release of heat as well. And the sebaceous gland, what's that for? Well, that releases sebum, which is an oily, waxy liquid that's involved in lubrication of the hair and the hair follicle. Okay. The erector pili muscle, that's when we get goosebumps due to contraction of the erector pili muscle. That's what that's for. And I think that's it for this slide, so we'll move on. Okay, so this is just showing you another nice image of hair anatomy. Okay, so you can see near the bottom there, you have your dermal blood vessels flowing, and that's where the hair follicle is receiving some blood supply. And then there's growth of the hair out to the surface of the skin. There's a sebaceous gland there. These sebaceous glands can sometimes become very enlarged and infected. And we call them sebaceous cysts. And they can be anywhere on the body. They're often on the back, sometimes on the scalp. And when they become very enlarged, we have to cut them open and drain all of this sebum, this oily, fatty substance, out of them because they're very uncomfortable for patients. Okay, we won't talk too much about sebaceous glands, but just know they can become really enlarged and infected, and they can require treatment. Okay, this next one's on nail anatomy. Your nail actually grows at the nail matrix, and if you were to lose your nail, it typically takes about 3 months for a full nail to regrow. Okay, so it grows pretty slowly. So the tissue that the nail is growing on is called the nail bed, and then of course the nail itself, the nail plate. Okay. Um, so we'll talk a bit more about nails later on. I think at some point you've come across the term onychomycosis, and that is a fungal infection of the nail. Okay, and that's why many treatments are for 3 months, because the treatments have to stay and have their effect on the nail while a new nail completely grows out. Okay. Okay, let's just talk about the epidermis a bit. So the epidermis is the top layer, and it's stratified keratinized epithelium. Okay, avascular. So there's no blood supply to the epidermis. Okay, and 95% of the cells are keratinocytes, which produce keratin, which is this tough substance that's waterproof. Okay, so it gives the skin protection, and it also waterproofs the skin by these keratinocytes. Melanocytes produce melanin, which provides pigmentation to our skin, and also provides protection from the UV light, right? So that's why most of us will tan in the setting of sunlight, because the skin is responding to the UV light and producing melanin, okay? And that provides protection to the skin, okay, to prevent potential cancers from forming, because UV light, as we'll see, is damaging to the skin and leads to a variety of cancers. So melanin provides protection to the tissue. Langerhans cells are immune system cells. They have phagocytic abilities in the epidermis. Okay, so just know that they're part of the immune system. And lastly, Merkel cells, well, they're part of the nervous system, and they're able to sense any cutaneous sensations and then send the signal back towards the basement membrane for the signal to then be sent on to the nervous system. Okay, so I'm not going to spend too much time on this slide. On the left, I've mentioned those cells already, the keratinocytes, the Langerhans cells, the Merkel cells, and melanocytes. And on the right is a lovely cross-section of skin tissue, right? So at the top, the dead keratinocytes. Skin has incredible cellular turnover. So if I was to think of which cells in the body have a high, or which tissues in the body have a very high turnover, it would be the skin and as well the gastrointestinal tract. Okay, there's other ones, but both of those systems have very high cellular turnover. Okay, so you can see the different layers on the left there: the stratum corneum, lucidum, granulosum, spinosum. That's a bit more of anatomy. We're going to talk about more conditions in this module. And this slide is helpful because it's just showing you the location of where all these cells are, right? The keratinocytes, the Langerhans cell, which provide protection for the epidermis, melanocytes, and Merkel cells there at the bottom. So it's a nice image just to get a good feel for the different cells that are in the epidermis. Okay, so let's look at the three different layers of the skin. The epidermis that we've already reviewed in terms of the cells that are within the epidermis. The dermal layer, which is going to contain most of the structures. And then finally, the subcutaneous layer, or another term for it is the hypodermis. and that's going to connect the epidermis and dermis to the underlying structures such as muscle. Okay, so let's just look what's in the dermis. So the dermis contains most of the structures of the skin. It contains blood vessels to supply nutrients and oxygen, and it allows diffusion of nutrients to the epidermis, since the epidermis doesn't have any blood vessels. Okay? It has the hair follicles, which are supplied individually by a little tuft of capillaries and as well a nerve to the base of the hair follicle. There's an erector pili muscle, which allows each individual hair to stand on end, right? Which is what we call goosebumps. The hair follicles have sebaceous glands that can secrete sebum into the hair follicle for lubrication. There's eccrine sweat glands that go directly to the surface of the skin all over the body for thermal regulation. Okay? There's also a vast network of nerve endings. Now, we did talk about Merkel cells being in the epidermis that can communicate with nerve endings. Well, now you're seeing the nerve endings within the dermis. Okay? There's a discrete membrane that separates the epidermis from the dermis called the basement membrane. Okay? And lastly, remember in the subcutaneous tissue, you also have mast cells and macrophages that are part of your innate immunity. So they're protective cells of the immunity that remain within the skin, waiting for potential injury or infection. And of course, mast cells release histamine that can cause vasodilation and increase permeability of blood vessels to bring in fluid and other cells. Okay? And macrophages can perform phagocytosis and also release cytokines to communicate with other cells to come to the area. Okay? So the dermis is where you have the most structures of the skin. Okay, so in this image, you'll see the assortment of structures that are within the dermis. Okay, so well, here's a slide on the dermis that I spoke about on the previous slide. I seem to do that quite a bit. So anyways, so the dermis, again, supplies nutrients through diffusion to the epidermis, okay, since there's no blood supply in the epidermis. And most of the structures of the skin are in the dermis. So your hair roots, sebaceous glands that attach to the hair follicles, sweat glands, nerves, and blood vessels. And again, it's mainly made up of collagen produced by the fibroblasts and also elastic tissue. Okay. The immune cells in the dermis, if you recall from an earlier module, there's macrophages there, and there's mast cells there that release histamine. Okay. There's also blood vessels in the dermis that allow for control of temperature, but also, of course, supply nutrition to the area. And lastly, there's nerves for sensation, right? So the vast majority of the structures in the skin are within the dermis. Okay, just an image of the basement membrane, which separates epithelial tissue from the underlying dermis. And remember, within within the dermis is where you have your mast cells and your macrophages that will be part of the inflammatory system. If there's an injury, say you cut your skin, well, they're going to be activated. And also the immune system, right? So macrophages are part of the immune system. Okay, so images, I think, can be very useful in terms of understanding the structures. So here you can see some eccrine sweat glands that are going from the dermis right up through the epidermis to the skin surface. Okay. Okay, so let's move on away from the anatomy of skin, and we're going to talk about skin conditions. But first, we'll just discuss just how we categorize and how we use different terms to describe primary skin lesions. Okay, so a cyst is usually fluid-filled. Okay, so for example, earlier I mentioned sebaceous cyst. Well, that would be a structure, a cystic structure that's filled with sebum. So any fluid-filled structure that's raised above the skin, we can call it cystic. Okay, a fissure is really just a crack in the skin. So whether it's the end of your fingers in the very dry winters, and you get fissures in your skin, or the corner of your lips, they sometimes get fissured in the dry weather. That's all it means, just a crack. A macule is a completely flat lesion. So if you were to run your hand over a macule, you wouldn't be able to feel the difference between the macule and the normal skin. It's completely flat. Okay, a nodule. So a nodule is a lesion that's raised above the level of the skin. And what's the difference between a nodule and a papule? Papules are usually just smaller. Okay, so a nodule is usually greater than 1 centimeter around, and a papule is usually less than 1 centimeter around. So it's really just the size of it. Okay. A polyp, well, you can get polyps in your colon that we've spoken about before, and they can actually become cancerous. Well, you can get polyps on the skin, and they're typically not cancerous. So you can think of a polyp as having a little stalk that attaches it to the skin, and almost like a head to it, and it just hangs off the skin. So it's a description, right? So we can describe a lesion as having a polyp type appearance, or a papular appearance, or a macular appearance, just depending on what it looks like. A pustule is again, it's raised above the level of the skin, but it's pustular, meaning there's pus inside. Okay, or for example, a whitehead from acne. Well, that would be pustular, right? Because it would have pus within it. A vesicle, well, they're small, fluid-filled structures. So, for example, herpes zoster. Well, that's a vesicular rash. It's fluid-filled. So small little blister type vesicles that if we were to cut one open, just clear fluid would leak out. Okay, herpes. So genital herpes or oral herpes, those are vesicular rashes as well. A wheal is typically when we're referring to an allergic reaction, right? So the wheal is the raised part, and it's typically has a bit of a pale appearance, and around it is a red area. So we call it a wheal and flare reaction, and that's typically a rash that occurs with an allergic reaction. Okay, so let's just quickly go around and I'll choose a condition based on um, the description that we can see in this image. So a cyst, I mentioned a sebaceous cyst. A fissure, I mentioned, say, a cracked corner of your skin or your lips, sorry, that are fissured. A macule, well, a macule is, say, a freckle or a condition where you've lost pigmentation of your skin called vitiligo. Well, it's totally flat still, so it would still be called a macular rash. A nodule, well, a nodule can be associated with acne, so nodular acne. Okay, raised lesions above the skin. A papule, smaller lesions, so you can have papules with acne as well. A polyp, say a skin tag. So typically under the arms, we can get these little skin tags, sometimes at the neck. They're just extra little bits of skin, and they have a polyp appearance. A pustule, well, those are whiteheads typically. They'd be associated with, say, acne, or if you had an infection of the skin called folliculitis, which is an infection of the hair follicles, and it shows up as multiple white pustules all over the place, well, that would be a pustular rash. A vesicle, I mentioned herpes, or, herpes simplex or herpes zoster. And finally, a wheal and flare, that would be an allergic reaction, such as an insect bite. Okay.